All right, welcome back, everyone, to the deep dive.
Great to be here.
Today, we're tackling something pretty fascinating, a partnership that looks set to, well, really shake up how healthcare professionals learn and train.
Yeah, it's a big one. We're talking about Kaohsiung Veterans General Hospital, KSVGH, over in Taiwan.
Right, KSVGH.
Nah,
And they've teamed up with EON Reality.
exactly.
So, our mission today really is to unpack this. How are things like virtual reality, augmented reality, and AI creating this new kind of training environment?
And what does it mean for healthcare in southern Taiwan and maybe, beyond?
Absolutely. And importantly, what could this shift towards immersive AI-driven training mean for you? Let's dive in.
Okay, so starting with KSVGH, it's important to understand who they are. This isn't just any hospital.
No, definitely not. They've been around since 1990, right? A
Yeah.
major public medical center.
A premier center, yeah. Really well known for providing comprehensive care, and they have some truly remarkable success rates, especially in areas like liver transplantation.
So a really established, respected institution.
Precisely. And what's interesting is seeing them embracing these, well, quite futuristic technologies. They're not just dipping their toes in, they're actively using EON Reality's tools to lead the way.
It shows real foresight, I think. So KSVGH is clearly committed. Let's talk about the other half of this equation, EON Reality. What do they bring to the table that makes this possible?
Well, EON Reality is, they're basically a world leader in this specific space. AI-assisted VR and AR for knowledge transfer. That's their whole focus.
Knowledge transfer, making complex information easier to learn and use.
Exactly. And their key technology, one of the really standout things, is this AI autonomous agent-driven text-to-XR conversion.
Okay, text to XR, that sounds complex. Break that down a bit.
It's actually conceptually pretty straightforward, though technologically advanced. Imagine you have a dense medical textbook chapter, or maybe surgical procedure notes, or even research findings.
Right, lots of text, diagrams maybe.
Yeah, static information. Their AI can essentially read and understand that information, and then automatically generate an interactive 3D experience from it.
Automatically. So it builds a VR simulation just from text.
That's the core idea. It builds an interactive VR or AR scenario. It makes creating this kind of immersive training content much, much faster and more scalable. It's not just about reading. It's about doing and experiencing.
Wow, okay. That really feels like a leap. So how does this actually play out day to day in a hospital like KSVGH? What does a doctor or a medical student actually do with this?
Okay, think about it practically. EON-XR, that's their platform combined with their AI, creates this incredibly dynamic learning space.
It's like a virtual training ground.
Exactly. But one where you can simulate extremely complex situations that might be rare or dangerous or just impossible to practice repeatedly in the real world.
Give me an example.
Sure. Imagine a surgeon learning a particularly tricky new laparoscopic technique. Instead of just watching videos or maybe practicing on a basic model, they can put on a VR headset and perform the entire procedure virtually. They can feel, well, not literally feel the tissue yet, that's still developing tech, but they can see the 3D anatomy, use virtual instruments that mimic the real ones.
And make mistakes without consequences.
Precisely. They can make mistakes. The AI can provide immediate feedback like your angle was slightly off there or you missed this critical step, and they can repeat it dozens of times until it's perfect.
That repetition and feedback loop sounds key.
It is. Or think about diagnostics. A trainee could interact with virtual patients, showing a huge range of symptoms, some incredibly subtle learning pattern recognition, much faster than just waiting for those rare cases to appear in the clinic.
So it compresses experience. Years of potential real-world encounters into focused virtual sessions.
That's a great way to put it. It compresses experience and standardizes the quality of that experience, too. Everyone gets access to the same high-level scenarios.
And for the listener, for you listening, the implication is, well, the professionals treating you could have a much deeper well of practiced experience, right? Especially for complex or rare conditions.
Absolutely. They've navigated tricky situations virtually before facing them under pressure in reality.
This all sounds incredibly powerful, but I do wonder about the limits. You mentioned tactile feedback isn't quite there yet. How much can VR truly replace that hands-on feel or, the human element of interacting with a real anxious patient?
That's a really important question, and it's key to understanding how this technology is best used. It's not necessarily about replacement, especially not for the human interaction side.
Okay.
It's about augmentation and preparation. It excels at building procedural skill, muscle memory, spatial understanding of anatomy, and critical decision-making under simulated pressure, things that are hard and time-consuming to teach traditionally.
So it makes the time they do spend with real patients or in hands-on labs much more effective because they've already mastered the basics or the complex steps virtually.
Exactly. It lowers the risk when they transition to real-world practice. It gets them further up the learning curve, faster and safer. And think about accessibility. This kind of advanced simulation can be deployed anywhere, not just major urban teaching hospitals.
Democratizing that high-level training, that makes a lot of sense. It aligns with what the leaders are saying, too. Dr. Chen Feng from KSVGH called it a significant leap forward.
In our approach to medical education and patient care.
Yeah, emphasizing the unprecedented opportunities.
And Dan Lajoskar from EON Reality talked about their commitment to transformative educational and training experiences, specifically in healthcare. It feels like both sides see this as more than just implementing new software.
Oh, definitely. It's strategic. KSVGH was already integrating things like telemedicine and AI into their work. They see themselves as a hub for medical research and education in their region.
So this EON Reality partnerships slots into that bigger picture perfectly. It strengthens that role. It helps bridge the gap that often exists between, say, cutting-edge academic research and what actually happens in clinical practice day to day. This tech helps translate new knowledge into practical skills much more rapidly.
Advancing both excellence and innovation, then.
That's the goal.
So recapping where we've landed today, this collaboration between KSVGH and EON Reality, it's really more than just adopting cool new VR headsets.
Much more.
It seems to be about fundamentally rewiring how complex medical knowledge and skills are transferred, practiced, and ultimately applied to patient care.
It's about making learning more immersive, more effective, more efficient, and crucially safer.
It really changes the equation for training.
It does, and that leads to a really provocative thought to leave with our listeners, with you.
Okay.
We focused on medicine today, obviously. But think about this model, AI-driven, immersive, readily available simulation training. What happens when this becomes the standard, maybe the global standard, for training in all high-stakes fields?
You mean like airline pilots, firefighters, nuclear technicians?
Exactly. Any profession where mistakes have serious consequences and where complex skills need to be mastered. If everyone can access this level of training, practice rare emergencies, learn new best practices almost instantly, what does that do?
It could massively accelerate innovation and skill adoption across the board.
Right. How quickly could new safety protocols or techniques spread? And bringing it back home, what could that ultimate shift mean for the quality, the safety, the effectiveness of the critical services you rely on in the future? Something to really think about.
A profound question indeed. That's definitely food for thought. Thank you for breaking that down today.
My pleasure. It's exciting stuff.
Absolutely. And thank you all for tuning in to The Deep Dive. We'll catch you next time.